He died in his sleep because of this. I beg you, stop doing it. It leads to heart attacks and strokes. Most people think heart attacks announce themselves with fanfare. Chest pain radiating down the left arm, a dramatic collapse in the middle of the day, a scene straight out of a Hollywood film. That is what the movies show, and that is what most people expect. But after more than 2 decades working as a cardiac surgeon, I can tell you with absolute certainty that the most dangerous cardiac events are not the loud ones. They are the quiet ones, the ones that build slowly in the dark, while you are lying peacefully in bed. No warning signs, no time to reach for the phone, no second chance. And here is what shocks almost every patient I speak to in the recovery room. Those events are almost always triggered by something completely ordinary, something unremarkable, something they did before they turned off the light and went to sleep. I am Dr. Anthony, and I have spent over 20 years as a cardiac surgeon. I have opened chests, repaired arteries, and held human hearts in my own hands. I have also spent those same 20 years watching the same preventable patterns repeat themselves over and over again in patients who had absolutely no idea what they were doing to themselves every single night. Tonight I am going to walk you through 5 of those patterns, 5 nighttime habits that are quietly loading the gun against your own heart while you sleep, and then I am going to show you exactly how to unload it, one simple change at a time. Before you go any further, I need to ask you one favor. If this video reaches you and you find it valuable, please subscribe to this channel right now. Hit that subscribe button, turn on the notification bell, and please like and share this video with someone you love, a spouse, a parent, a sibling, or a friend who is over 60. You could be sending them something that genuinely saves their life. And wherever you are watching from right now, drop your location in the comments below. I love knowing where my viewers are tuning in from around the world. Now let us get into what you came here for. Here is something that most people do not know, and it surprises even educated patients when I explain it. Your cardiovascular system does not take a rest when you fall asleep. It does not clock out for the night. What it does is shift gears entirely. In a healthy body, nighttime is the window when your blood pressure naturally dips, usually somewhere between 10 and 20% lower than it is during the day. Your heart rate slows, your arteries relax. It is a biological reset, a form of internal maintenance the body has been running faithfully for your entire life. But here is the critical part that changes everything after the age of 60. That system becomes far less reliable, the blood vessels stiffen, pressure regulation becomes less precise, certain hormonal signals that once protected the heart during sleep begin to weaken, and the margin for error gets much smaller than it ever was when you were younger. Think of your cardiovascular system during the day like a fully staffed hospital, backup mechanisms in place, capable of compensating and adapting quickly. Now think of that same system at night after 60 as running on a skeleton crew. Many of those backup mechanisms are simply offline. That is what makes the nighttime hours so uniquely dangerous. That is why the hours between midnight and 6 in the morning carry the highest risk of heart attack and stroke for people over 60. The quiet hours, the hours when no one is watching but your habits are. What happens during those dangerous hours is largely determined by what you did before bed, the meal you ate, the pill you took or forgot to take, the temperature of your room. Let us start with the habit that surprises my patients the most. I want you to think back to last night. What time did you eat dinner, and what was on your plate? I ask every patient that question during consultations. And for a striking number of people over 60, the honest answer is somewhere around 8 or 9 at night, sometimes as late as 10. A full meal, pasta, rice, a heavy serving of meat, perhaps something fried followed by a stretch on the couch, then bed within an hour or two. I completely understand how it happens. Busy days, family schedules, the deeply ingrained habits of a lifetime. But from a cardiac standpoint, this pattern is one of the most silently destructive things you can do to your heart on a daily basis. Here is what is actually happening inside your body when you eat a large meal late and then go to sleep. Your digestive system demands an enormous surge in blood flow the moment food starts moving through your system. Your heart has to pump significantly harder than usual. Blood pressure rises. The fats in your blood, your triglycerides, spike sharply within 2 to 4 hours of eating. Now layer that on top of your body simultaneously trying to enter its nighttime recovery mode. Your body expects the evening to be a wind down. What it gets instead is a full cardiovascular demand. Your heart is being asked to work overtime, digesting a heavy dinner, while also trying to execute the quiet restorative work it needs to do during sleep. Those two demands are in direct conflict. And in a person over 60 with any degree of arterial stiffness, that conflict has real and measurable consequences. Studies have consistently shown that eating within 2 to 3 hours of sleep is associated with elevated nighttime blood pressure, higher rates of acid reflux that can mimic and trigger cardiac symptoms, and an increased risk of cardiovascular events during the night. The fix is not complicated. Finish your main meal by 6 or 7 in the evening. If you need to eat something later, keep it light, protein and vegetables rather than heavy fats and carbohydrates. That single timing adjustment gives your heart the window it needs to begin its overnight recovery. Look honestly at your dinner schedule. You may be surprised to find it matches exactly what I just described, and you may never have once connected it to your heart. Now I need you to pay very close attention to this, because in my clinical experience, this is where some of the most preventable damage happens. If you are over 60 and you take medication for high blood pressure, and statistically more than 60% of people in that age group do, the timing of that medication matters enormously, more than most doctors take time to explain. For most people, blood pressure follows a predictable curve throughout the day. It rises in the morning, reaches its peak in the afternoon, and dips during the night. But a significant portion of people over 60, particularly those with hypertension, do not get that protective nighttime dip. Their pressure stays elevated, or in some cases it actually surges during the early morning hours. This condition is called nocturnal hypertension. Most people have never heard of it, and it is dangerous in ways that standard daytime high blood pressure simply is not. While you sleep, the walls of your arteries are not braced for impact the way they are during the active hours of the day. A pressure surge at 3 in the morning hits the arterial walls in a fundamentally different way than one at 3 in the afternoon. It is far more likely to rupture a vulnerable plaque sitting inside a coronary artery, more likely to trigger the formation of a clot, more likely to send someone to my operating table before sunrise. If you take your blood pressure medication only in the morning, there is a real possibility it is wearing off precisely by the time you need it most. If you forget to take it at all, you may be leaving yourself completely unprotected during the most vulnerable hours of the night. What should you do? Talk to your doctor specifically about timing. Ask the direct question, should my medication be taken at night rather than in the morning? That conversation takes 2 minutes. It costs nothing, but the evidence behind it is powerful. Research including the HYI chronotherapy trial has shown that evening dosing of blood pressure medication significantly reduces cardiovascular risk during sleep. That is not a minor lifestyle tweak. That is a potentially life-saving conversation that most patients over 60 have never once had with their physician. In cardiology, timing is not a footnote. Timing can be the entire difference between a life continued and a life cut short. Please do not assume the timing does not matter. Please have that conversation at your very next appointment. Now I want you to think about someone you know who snores. A spouse lying beside you at night. A parent you have heard through the walls. Maybe if you are honest with yourself, it is you. That sound, that loud rumbling, irregular breathing in the night, most people treat it as something to laugh about over breakfast. Something to nudge your partner over. I treat it as a cardiac warning sign until I have clinical proof otherwise. After 20 years in this field, I mean that without any exaggeration whatsoever. Sleep apnea is one of the most underdiagnosed and dangerously underestimated conditions I encounter in patients over 60. It is estimated that over 30% of older adults have some form of it, and the vast majority have never been diagnosed or treated. They have no idea what is happening to their heart while they sleep. Here is what actually occurs during an apnea episode. You stop breathing for 10 seconds, 40 seconds, sometimes longer. It can happen dozens of times in a single night. Each time the oxygen level in your blood drops sharply, and your brain registers it as a crisis. It fires off a stress response, adrenaline, cortisol, a sudden spike in both heart rate and blood pressure. Your heart essentially jolts awake while the rest of you remains asleep. Now imagine that happening 30, 40, or even 50 times in one night, night after night, year after year. What that does to the cardiovascular system over time is not subtle at all. Sleep apnea is directly associated with a 3 times higher risk of heart attack. That number alone should stop you cold. It is strongly linked to irregular heart rhythms, including atrial fibrillation, which itself dramatically raises the risk of stroke. It accelerates the thickening and stiffening of arterial walls, and because the person experiencing it is unconscious for all of it, they often have absolutely no idea until something serious happens. The warning signs are not always obvious. Yes, loud snoring is one of them, but watch also for waking up with morning headaches, feeling exhausted even after a full night of sleep, needing to urinate frequently during the night, or waking up with a dry mouth and a sensation of choking or gasping. If any of those sound familiar, speak to your doctor about a sleep study. If you snore heavily, you are over 60, and you have any history of heart disease or stroke, getting evaluated for sleep apnea is not optional. The treatment, most commonly a CPAP device, is not glamorous, but the data on what it does for the heart is remarkable. Patients who follow CPAP therapy show measurable reductions in blood pressure, significantly lower rates of atrial fibrillation, and a meaningfully reduced overall cardiac risk. The fourth habit is one almost nobody discusses in terms of heart health, and it is driven by completely logical reasoning, which is exactly what makes it so easy to overlook. Many people over 60 deliberately limit how much they drink in the evening. The reasoning is understandable. They want to avoid being woken up at 2 in the morning to use the bathroom. Disrupted sleep is uncomfortable. Getting up at night increases the risk of a fall, so they cut fluids after dinner, sometimes as early as 4 in the afternoon. I understand the thinking completely, but from a cardiovascular standpoint, going to bed even mildly dehydrated is a meaningful risk factor that almost nobody talks about. When you are dehydrated, your blood becomes more viscous, thicker, more sluggish, and far less able to flow freely through your blood vessels. For a young cardiovascular system, that is a manageable inconvenience. For a person over 60 dealing with arterial stiffness and plaque buildup, it is a very different story. Thick blood moves slowly through already narrowed arteries and is far more prone to forming clots. During sleep, your heart rate naturally slows and blood moves through the system more slowly anyway. Combine that with thicker blood in a body lying still for 7 or 8 hours inside arteries that may already be narrowed, and you have one of the core reasons strokes and heart attacks cluster in the early morning hours. The fix is genuinely simple. Drink a full glass of water before bed, just 8 ounces. That is all it takes to ensure your blood is not thickening dangerously overnight. Keep another glass on your nightstand. That moment of mild thirst at 2 in the morning is your body asking for something your heart also needs. The fifth habit surprises almost every patient I mention it to, because it sounds almost too simple to matter. What temperature is your bedroom at night? Most people have never once thought about it in terms of heart health. They think about personal comfort, about preference, about whether they sleep better warm or cool, but there is a specific temperature range that your cardiovascular system actively prefers, and outside of that range, your heart is working harder than it needs to all night long. When your bedroom is above about 22 degrees Celsius, roughly 72 degrees Fahrenheit, your body works continuously throughout the night to dissipate heat. Your blood vessels dilate, your heart rate stays elevated, and sweating increases fluid loss, which brings us right back to the dehydration issue we just discussed. Critically, your sleep quality drops. You spend less time in the deep restorative stages of sleep, where the heart gets its most important overnight recovery. Now the opposite is also true. A bedroom that is genuinely cold, below 16 or 17 degrees Celsius, creates a different kind of cardiovascular stress. Cold triggers vasoconstriction, meaning your blood vessels tighten to preserve your core body temperature. Blood pressure rises. The heart has to push against significantly more resistance. For someone with existing coronary artery disease or hypertension, that nighttime pressure increase is not trivial. The optimal range for both sleep quality and cardiovascular protection is between 18 and 22 degrees Celsius, 65 to 72 degrees Fahrenheit. That window keeps your body in thermoneutral territory, vessels relaxed, heart rate low and steady, and sleep staying deep and restorative. One simple thermostat setting, real and meaningful protection. I want to be honest with you now, not as a content creator but as a surgeon. I have stood at an operating table at 3 in the morning, holding a heart that stopped because of a clot that formed overnight in a narrowed artery. I have spoken to families at dawn who had no idea anything was wrong when they said goodnight just hours before. And in case after case, the contributing factors were not mysterious. A late dinner, a skipped medication, a bedroom that was too warm, a body running out of water, an airway silently collapsing for years while everyone assumed the snoring was just snoring. These are not rare occurrences. They are the background noise of millions of ordinary evenings, and that background noise, accumulated night after night and year after year, can become a cardiac event nobody saw coming. The truth 2 decades in the operating room has given me is this: most of the hearts I have repaired did not fail because of bad luck. They failed because of bad information. Information the patient simply never had. You now have it. The only question is what you choose to do with it tonight. Let me bring everything together for you clearly, because I want you leaving this video with a concrete action plan, not a vague sense of worry. Finish your main meal by 6 or 7 in the evening. This is not a radical dietary overhaul. It is simply a reasonable dinner at a reasonable hour, giving your heart a full 3 to 4 hours to settle before sleep. Talk to your doctor about the timing of your blood pressure medication. Ask specifically about evening dosing. That single conversation may be the most important medical discussion you have this entire year. If you snore, if you wake up exhausted, if anyone has ever told you that you stop breathing during sleep, get evaluated for sleep apnea. This is not optional once you are past 60. It is a core part of cardiac care. Drink a glass of water before bed and keep one on your nightstand. Do not allow your blood to thicken overnight because you were trying to avoid a trip to the bathroom, and set your bedroom temperature between 18 and 22 degrees Celsius, 65 to 72 Fahrenheit. That one number protects your blood vessels while you sleep and costs you absolutely nothing. Before I close, I also want to remind you that sleeping on your side rather than your back, if you snore or have been told you stop breathing during sleep, can reduce airway obstruction significantly. It costs nothing, requires no equipment, and you can start tonight. I genuinely want you to answer this in the comments. Which of these 5 habits do you recognize in yourself? I have a strong feeling that at least 2 or 3 of them hit close to home. You are not alone in that. Most of the patients I see recognize themselves in this list. The difference between them and you is that you now know what to do about it. If this video gave you something useful, I am asking you directly to please share it. There is someone in your life, a spouse, a sibling, a close friend, someone over 60 who has never once connected their nightly habits to the health of their heart, who needs to see this. Send it to them today. And if you have not already, please subscribe to this channel, hit the like button and share this video so that it reaches as many people as possible. What you share today could genuinely be the information that saves someone's life. Take care of that heart. It has been working for you every single minute of every single night for your entire life without a single day off. Give it the conditions it needs to keep going. One final and important note. Everything I have shared here is general medical information based on current cardiovascular research and my own clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medication schedule especially, please speak with your own physician first. That is not a legal disclaimer. That is genuine advice from someone who wants you still watching this channel in good health 10 years from now. Good night, sleep well, and take care of yourself starting tonight.